At iFace Institute, we get a lot of referrals from doctors when patients have lumps and bumps around the eyes and in different areas of the face, especially with the eyelid itself, because it's so important for the health and the aesthetics of your eyes. You know, they want to make sure that any lesion that's there, first of all, is not something that's going to hurt you. It's not dangerous for your health. And if and when we decide to remove it, it's removed in a way that the functionality of the eyelid is preserved and the aesthetics are such that we haven't disturbed your eyelashes, we haven't disturbed any of the critical structures that you need for the health of your eyes. So here at iFace Institute, we really have an expertise in this area, and that goes for other facial lesions as well, whether they're on your lips or on other areas of your face where you want to have it removed but you don't want a scar on your face. And that's something that we use a variety of instruments for, whether it's lasers or electrocautery or surgical interventions. And again, we'd be happy to chat more with you depending on your unique needs. Lumps and bumps around the eyelids and face really can affect any patient. I've had 5-year-olds that have come in and patients, and their family members were worried, and it typically is a benign wart or something that can be managed very conservatively, all the way to series of cysts or other larger lesions that can impact the eyelid itself or the cheeks or the neck. So here we have surgeons that are very uniquely trained to remove these types of lesions for you in a safe way where you don't have any scarring and we do not disturb your natural anatomy, and we keep your health in mind as well as the cosmetic result that you're after. After lesions are removed from the eyelids or the facial structures, typically you have a little bit of bruising and swelling the first week. Most people will notice a slight redness to the area that's treated, depending on whether a laser was used or whether we've used a surgical intervention. I tell patients that 4 to 6 weeks is the timeline where the incision will look like it's healed naturally and it will not draw any attention. The final result always takes 3 to 6 months.